Hi, I'm Kalvin Pugh, and this is HIV Connect, a podcast from the International Association of Providers of AIDS Care, or IAPAC, that brings into focus what living with HIV looks like today. In each episode, I connect with clinicians, experts, and community leaders in conversations about clinical and psychosocial management issues such as aging, stigma, and sexual health topics that matter to people living with HIV. Today's episode is all about adherence. My guests are Dr. Rivet Amico, an associate professor at University of Michigan School of Public Health. She has worked in the area of social behavioral science and HIV treatment and prevention for over 2 decades. Her contributions have included models of adherence and well-being that emphasize context and social determinants, brief interventions to support participants in studies and patients in care, measures of stigma and feasibility, acceptability, and a consistent advocacy for person-first, community-at-center approaches and programs. Dr. Amico works globally in her ongoing efforts to engage bidirectional learning and capacity sharing. And Porchia Dees, who's an HIV influencer, a self-described artivist, and founder of Positive Vibes Only, with a mission to heal holistically and inspire others to take better care of themselves, physically, mentally, and spiritually. Porchia is a Service 1 coordinator at Step Up and attends Azure Pacific University's MSW program. Since 2013, Porchia's advocacy work has allowed her to make contributions with organizations like the Well Project and the Vertical Special Interest Group within the National HIV and Aging Advocacy Network. Taking HIV medications as prescribed, otherwise known as antiretroviral or ART adherence, is critical for people living with HIV to achieve viral suppression, which is the foundation for U equals U, or undetectable equals untransmittable. ART adherence requires a lifelong commitment from the individual, but is far more complex than just pills to mouth. Thank you both for joining me.
Thank you for having us.
So let's begin with why. Why is antiretroviral therapy or ART adherence so important?
So for me, unless you're a non-progressor, which is someone who doesn't need antiretroviral therapy or HIV meds to remain undetectable, it's important because so that you can get to an undetectable viral load and you can, maintain, or you can control the virus and so you won't get sick. It's very important so that, you can stay healthy and you can live for as long as anyone else. You know what I'm saying? A normal, healthy life.
Absolutely. And I mean, full disclosure, right? I'm not an MD, right? I'm a psychologist and public health advocate in my work and practice. So there's a few medical reasons, that are worth mentioning. Some have already been mentioned that if you can adhere to an effective regimen, then you can reach viral suppression. Right. And viral load is, used to measure how much HIV is circulating in your body. So the more circulating, the more damage it's doing to your body. So with effective ART, you can dramatically drop that amount, right, to levels that are so low that the tests used to look at the virus don't even see it. And that's undetectable. And so the benefits of being undetectable is that, longer life, less damage to your immune system, and less effects from the virus. The flip side is that having a lot of virus uncontrolled by medications does damage to your immune system and makes you feel sick, and you might get infections that can be life-threatening. But I did want to note that in terms of the medical pieces that are there, I mean, I think that's pretty clear, right? Your physical health. But there's mental and health and well-being kind of components to it as well. So psychological factors make adherence important, right? And relevant in life living with HIV. So if you can reach viral suppression and keep it down through consistent use of antiretrovirals, you not only have stronger health, but you also can't pass on the virus, right? Undetectable equals untransmittable. And that is a real source of comfort for a lot of people. And a lot of people experience that as a major change in their functioning and their well-being. So not being able to reach viral suppression can also be a source of frustration. So it's not only about physically doing well, it's about mentally feeling well also. Feeling like you can control that HIV and that you're on top of it. I mean, that can be very meaningful.
Yeah, I like that treatment as prevention piece you added in there as well. Not just about yourself, but for community as well.
Well, I think that's one of those things that have really revolutionized things for all of us. I know, for someone who's born with HIV, things like U equals U and TASP weren't maybe the messages that were given out at first. And I think we, in that context, we got to think about too, folks who maybe don't get that message in a clinical setting. As someone who worked in a clinical setting, I did see providers who were resistant to sharing that message. But what we found when we were doing surveys of people talking about U equals U, how motivating that was to be adherent to their medication. So, I think there's a flip side to both of those. Yes, it's important to keep us healthy, but also that motivation piece to stick with it.
Right. I like how Dr. Amico talked about the mental, the psychological effects to adherence as well. Because as you were mentioning, Kalvin, being that I was born HIV positive, I had to learn that, I had to learn to, I guess, to keep up with my adherence and the medication is really something that I need the hard way, I think for a long time, I was adherent to my medication because my parents made me be adherent to my medication, like I wasn't in control of that. I had to take my medication, and my aunt and uncle made me take my medication, but there was a point in time where I struggled with adherence. And that was during the transition from pediatric HIV care into adult HIV medical care, and everything that was going on in my life at the time. I also lost my biological mother due to AIDS-related illnesses around the same time, my junior year of high school. And I transitioned from pediatric care to adult care when I was 21. So it was all happening around the same time. My mother wasn't adherent, and I think it was because a lot of the things she went through psychologically, in her social life. This was back in the 80s and 90s. So, where the stigma was very much so, heightened. I think there's still a stigma, but it was worse, and my family kind of scapegoated her, and she didn't really have very much support. So she kind of went into a more downward spiral with drugs, and that was her coping mechanism, And so watching my mom not be adherent, watching her pass away, we don't talk about these kind of things in our family, like the Black families, and I'm sure it's universal in other, ethnic and racial groups as well, the culture of silence. So I also those things affected me, and so when I transitioned, I kind of fell out of care too. It was it was a lot of things happening. I thought that was what was going to happen to me anyways. I was going to die anyway. So, I also was fresh into college, and I didn't want people seeing me taking my meds. I'm probably jumping the gun, to other questions, but it was a lot of social, mental and emotional things that was going on that affected my adherence.
I appreciate what you're saying, because it really calls attention to this is not about pill to mouth. This is not about showing up for an injection. It's part of a larger kind of network of self-care, right?
Yes.
And so everything that's going on in your life around and that can challenge that, can be a real barrier.
Yes, ma'am.
So I think we've touched on some really important things about how art is affected both by our circumstances or our mental health or the challenges that we go through. So if you were talking to someone who was newly diagnosed, what would be a key message that you think they should hear?
I have a few, actually. So I think treatment's available, right? Not everybody knows. Some people know, treatment is available, but not everybody knows. So treatment is available and it can control the virus. So immune functioning is protected. You can live a long and very healthy life. I would also add in a request for people to kind of be aware that they can be active in the decisions around their care. And that includes kind of what therapies they're prescribed, what different kind of profiles those medications have and when you need or are supposed to take them. More and more choices are going to be coming along. But to be active in that, know you equals you. No help is available. I would say prioritize your well-being, not just your physical body. I think the other thing I would say, especially when working with youth, but with everybody, is that, this is going to be hard. It's going to be hard for a bit, but you're worth it. And continue that telling people that you're worth this challenge.
For me, I would say, I know when I stepped outside of self and looked at, like the fact that it's not just me going through this, and even outside of the HIV and AIDS realm, a lot of other people in the world are struggling with other health conditions that also have to take treatment. And some of their treatments are more harsh, like on more harsh types of therapies than the ones that we have to take. So I would say like that, thinking about that you're not alone. It's not just us. Like, it's not just folks living with HIV who are on therapy or on treatment. Again, the different type of therapies too, that you can you have a choice now. There's one pill once a day as opposed to the many therapies that we used to, the many pills that we had to take in our regimen back in the day. And then now the injection, medication. I actually have been talking to my doctor about that, like switching over. You can take a shot every other month now, and you don't have to take a pill every day anymore. Like, how awesome is that, right? But that's what really helped me, is thinking about it like, okay, I don't know. It's not just me. I'm not alone in this, because I used to think, why me? And I think a lot of folks, their medicine reminds them of maybe their status, or they might get treatment fatigue from taking medicine over the long periods of time. But what helps me is just thinking about like, it's other folks are taking treatments for other things, and sometimes their treatments are a lot worse. And I can do this. This isn't that bad. And so that would be my message.
I love that.
Like I was saying to you guys back, when I fell out of care, before I fell out of care, there were many reasons as to why I wasn't remaining adherent to my medication. Now that I've been through that and I'm doing what I'm supposed to be doing now, like still every once in a while, because I'm so busy, sometimes I might forget, or like, I'm afraid that what if I took my medicine twice, because I forgot like that if I took it and then like I just want to take it again to be safe. Like, I'm sure I've done that plenty of times. Or just having to worry about like when you're going on a trip to pack your medication, you won't have to worry about no more. So that's like super awesome, I don't know. I'm just super excited about that. And even thinking of how much further it can go. Like if we can take a shot every other month, like what if it gets to, we can take a shot every year or, like, I don't know. It just, the U equals U thing was like the first big like life changer.
And I agree with you, Porchia. I think there's a lot of things in the pipeline. There's a lot of innovations that hopefully will come around in the next few years, actually, that are going to get longer and longer and longer. You do need to get your initial dose. You come back a month later, and then you get on your every other month.
Okay.
Yeah. So, but every other month, how amazing is that to be able to take advantage of for your complete regimen?
Yeah.
I think there's some, ongoing back and forth of whether or not that's going to kind of resolve potential adherence challenges, but adherence starts to take a different face. So adherence is going to mean, are you showing up for your injection visit within about a week of the time that it's scheduled? And if you go beyond that week, now some complicated protocols come in place with whether or not you restart oral medication for a period of time, and so on. But if you get there within that 1 week window, that's going to be quote unquote optimal adherence. I just love that we're getting choices. It's not going to be for everybody, right? But it's going to be for some people, and for those people, it's going to be a game changer.
Well, I think what you just said is one of those things that comes up, and you've kind of brought it up before, that the power of choice, because there are so many options for folks, that's really powerful. I know that, I'm sure when Porchia was taking medication as a kid, that list was limited. I know my first appointment in a doctor's office, the poster in the office it wasn't short, but it looks nothing like it is today. They need more pages today than they needed on the one page when I first walked in there. So I think, choice is such a powerful thing, and it's such a game changer.
Yeah. I think there's over 30 HIV medications now.
Which is,
you guys, not even, this isn't a fun fact, but when I was a kid, I was born 10 years before antiretroviral therapy came out. So I was on a bunch of clinical trials, and I had one of those hard shell lunch pails, you guys, like with the Disney characters on them. And it was filled with medications. Like I had to take maybe like 10 in the morning and 10 at night. And some of them were medications for the side effects of the medication. So I'm just ecstatic at where we are at today.
That's amazing.
Yeah.
I do want to throw in there, not to be a downer, but, equitable access to injectables, both domestically and globally, I think needs to stay pretty firmly on our radar. And then we also need more data. We need more data for youth, pregnant women, other populations that weren't part of the initial trials. So really making sure that that cost is manageable, that it's included in the formularies. And also, how this might work for people who are not virally suppressed, because right now this is for people who are virally suppressed, at least in terms of the approval. And I know there's studies going on, but I mean, we really want to be able to see if someone who's struggling with daily oral could use this, and this might be, their game changer. So really thinking about the inclusiveness, making sure that it's available more widely, and hopefully we determined that it's safe and effective for people who are not virologically suppressed right now.
That's a good point.
So we've talked a lot about some of the challenges you had, Porchia, and we've talked about some of the things that have really challenged folks. But I think one thing that might be of interest to folks is there room for error when it comes to pill-based versus injectable art? We've talked, there's kind of an error space there for injectables, but really how much adherence is enough?
adherence?
So, I mean, I can talk about it from the research side, but I'm real interested in what Porchia has to say from her own experiences. So I would say it depends on your regimen, right? So several years ago in that lunchbox kind of regimen, you needed near perfect adherence. I mean, near perfect, almost 100%, to be able to really see the benefits. Nowadays, with the kind of regimens that are out there and tend to be prescribed, if you can hit about 80% adherence over the course of a month or so, that's typically adequate. For injectables, again, your adequate is going to be trying to make sure that you meet the date of your next injection visit. And if you have to miss it, try to make sure that that's not more than 7 days out. Do it as close as you can to when the scheduled visit is.
I mean, I think I'm gonna echo you right now, Dr. Amico. I feel like, and I don't know what it's called, but like you said, the older medications, if you would become resistant to the regimen easier than like the medications that's the newer ones today. I don't know. It's a high, I don't know the scientific term for it, but like you said, there's like a 80% adherency, I guess, rate, or I don't know if that's how you say it, but I think from a personal, like my personal opinion on it is I think people also get to choose, if they want to be adherent to their medication or not. Like, I think that's even a choice. Like I wouldn't recommend, taking like med holidays if you're tired, or like, not being adherent to your medication. But honestly, I think that choice also is the patient's choice, the person living with HIV's choice. That's their choice, if they want to be adherent or not, if they want to take their meds.
You're absolutely right, though, right? I mean, this is a self-driven thing, behavior. And so if we talk about intentional non-adherence, where so often people assume it's unintentional, but there's intentional non-adherence.
Yeah, that's a touchy topic.
Well, and ultimately that is someone's decision. And I think anyone in public health or who loves that person is biting their nails because it can be so severe what the consequences are. But ultimately that's what autonomy is. So you're not wrong. It's just, certainly challenging for those who care for that person to kind of see that process.
Exactly. I see it all the time in the field of work that I do. So that's why I wanted to say it.
Well, I think that's important. Those are important points to make because, just like Dr. Amico wanted to point out the inequality in distribution of injectables. These are real things that, often don't get a voice in a public space. We talk about them behind doors in research facilities or in nonprofits or NGOs, and those conversations don't make it out to the wider world. And so there might be someone who listens or watches this who might think, oh, I'm not the only person who deals with that. But so often, and I think with all of the things that have happened in our world the last couple of years, we tend to feel more isolated. And I think my hope is that, someone listens to one of these episodes and thinks, oh, I'm not the only person who feels this way. Because if folks aren't connected to a community or a support group or a peer educator, HIV can be a very isolating bubble to live in, especially if you don't know other people. And I think it's easier than ever to access other people living with HIV than it ever has been. I remember my first social media post about living with HIV. There was 5 of us on Instagram, and now there are hundreds.
Yeah.
There's a positive aspect to some of the things that the negative things, bringing them up in conversation can have when we talk about the things that might be isolating for someone.
Yeah. I have folks that I follow that I know that that are they're trying to control their viral load like through their diet, through their eating. Like they don't want to take their medications, and that's their choice. And just folks who just prefer not to, So I wouldn't, because I had to learn the hard way and I got really sick. I don't encourage that for anyone, but and that was a game changer for me too when I got connected to communities of folks living with HIV or going through the same thing that I was going through. That changed everything for me and empowered me to want to get back in care and stay in care and live.
And live you do, my friend.
Yes.
So what are some of the challenges? We've talked about some of these things, but I mean, what are some of the barriers and challenges to ART adherence that people both newly diagnosed and those who are treatment experienced face? I think this is another moment for us to talk about things that people might feel isolated about.
You want me to go first on this one, Dr. Amico, or you want to go?
Yes. Okay, I'll jump in because I have a feeling that you can really put some flesh to these bones. But, over the years, there's been so many like rubrics, classification systems. Oftentimes it's thought about in terms of barriers. You have characteristics of the medication. How many are there, and are they experienced as toxic? The systems providing that medication. So what is it like interacting with that? Are they respectful at the point of care? The person themselves, right? Thoughts, beliefs, feelings, as well as their social networks, but then also the disease itself and the way in which society stigmatizes, or otherwise relates to that disease. All of those different areas can produce challenges around adherence, and actually aspects of some of those areas can really foster adherence as well. So I think in terms of at least what it seems to be out there is that in addition to side effects, right, and wanting to avoid them, some of the top reasons for non-adherence are literally simply forgetting, right? But also competing priorities. So that could include anything from a demanding work schedule to active drug use. And also the drug being a negative reminder, right, of living with HIV, or having to depend on medications. And before I pass it over to you, Porchia, I just want to emphasize to anyone who's listening that this is not unique in some ways to HIV, right? Like human beings have a hard time doing something daily that doesn't have a clear and pretty immediate reward or outcome. So taking medication on the daily that doesn't give you relief from something that's uncomfortable, like a headache or pain, or doesn't bring you to a state that you'd like to be in, that's really difficult to do. And HIV drugs might actually make you feel worse than when you started, especially as you're just getting started on them. So I think there's plenty of barriers and challenges. There's lots of things that can also foster adherence, but I just want to emphasize how really normal that is. And I think the more people can understand that this is a legit challenge and this is not a simple like, oh, it's just once a day. What's wrong with me? Why can't I do it? It's challenging. It's challenging for everybody. It's challenging across different conditions. So asking, for help is okay.
Yes, ma'am. I think you pretty much covered everything. I'll add personal experiences to what you said. Even like having a sinus infection or something, and taking that Z-Pack, and you got to take the 2 at the beginning and then after that for the rest of the week. But once you feel fine already, I know sometimes I don't finish my Z-Pack because I feel better already and I feel like I don't need it, but you're supposed to finish it all the way through, right? And that's kind of I feel like how folks with HIV feel, also you feel okay, you feel good. And so I know that was one of the reasons when I was younger, when I graduated, I like didn't want to take my medicine anymore for various reasons. And then I felt okay still. So I was like, I don't need it. But that's not true. That wasn't true. But yeah, a lot of the things you already mentioned, you know, I was in college. I didn't want folks to see me taking my medicine. I think that speaks to the stigma piece that you were talking about. I actually got outed a couple of times because folks saw my meds in the refrigerator. And the treatment fatigue is like when you've been on medication for a very long time. That's a big thing. That played a big role in why I stopped taking my medicine then, and sometimes why I feel like I don't want to take my medicine still now, because you're just tired. You're tired of it. But yeah, no, all those things you mentioned, breeds our challenges. I I don't think I have nothing extra that you didn't hit on that I could think of right now.
So I would love to ask a question. Sorry,
Yes,
I'm
ma'am.
derailing the questions, but I'm curious, Portia, you've mentioned several times that you needed a period of time where you were like, I'm not going to take it for a spell. How did you know that you didn't want to continue on that path? Like what was it that made you realize, wait a minute, I do need this?
I got really sick. It took about 6 years. So that was in my early 20s when I had graduated high school and I went to college. And I think also that environment of things, I think you mentioned conflict of like
Competing priorities.
competing priorities. That's what you
Yeah.
said. So, I was fresh in college. We were in the like partying,
Yeah.
college party stage, turn up. We were drinking all the time, and also how the medicines interact with alcohol when you're drinking. It doesn't feel very good. So I literally didn't want to take my medicines because I'd rather drink and have fun and live. And that was what living my life was to me at the time. And so I would get sick. Like sometimes I would be on and off my medicine, and I definitely wasn't going to my doctor's appointments. And I would get sick sometimes and start taking it, but then go back to not taking it. But after about 6 years, and again, I thought I was okay. Like I felt good until it took that long for my T cells to get really, really low. And then I got pneumonia. And I knew I had pneumonia because I've been used to getting pneumonia. So I knew that that was it. But then also my kidneys failed. I had acute kidney failure and a couple other opportunistic infections. And I was in the hospital for like a long time. And I was scared. That was the most scared I've ever been in my whole entire life. And I prayed and I was bargaining. Like with God and everything. And they didn't want to start me on dialysis because I was so young. I was only 24. And then they finally did after a couple of weeks. And after 3 dialysis sessions, my kidneys started working again. They started me on my treatment and stuff. And I got better and I got out of there and I felt like, okay, this is my second chance and I got to get my together. And I did from there. So yeah, that's what happened. And I got connected to my first community advisory board and got to be around other folks who were living with HIV because I thought I was by myself back then. And it just was up from there, Dr. Amico.
Thank you for sharing that. Thank you.
I think
You're
that was
welcome.
really powerful, Portia, especially for folks who may be, experiencing some difficulty and challenges in their adherence, or who might be newly daunted by the fact that I've got to take this medication every day. And I think,
it's
that's why I asked
important,
you to be here, because,
guys.
your story is very powerful.
Thank you.
So maybe piggybacking off of that, what are some of the best clinical and behavioral tools available today to support ART adherence?
I'll start by saying, like you mentioned in my bio, to me, optimized healthcare, it addresses the whole person. So not just like, going to your doctor's appointments and getting your labs done and taking your medication, but like that mental and emotional aspect of things. So connecting patients to support groups. Support groups are, to me, like a very powerful tool for folks. Or to therapy, Dr. Amico. Yeah. I got into therapy last year, and that changed my whole entire life. So yeah, and just those wraparound support services that really address those social determinants of health.
Absolutely. Absolutely. I'll throw in there that there's a number of different toolkits. There's guidelines. CDC has Every Day, Every Dose Toolkit and app. IPAC has issued guidelines. Ton available online. But what I would really encourage everybody to recognize is that we will never have a one size fits all for adherence support. No, should we? Right? We really need to be thinking creatively about identifying needs, looking around at what resources are available that can connect someone to be able to kind of address either individual level or community level needs. And if they're not there, that's where we need to kind of innovate different programs to be able to address those. And I really like what Porchia was saying about the wraparound services, because when I think about needs, memory, reminders, alarms, sure, those are needs. Access, right? Very important need. But also I would include mental health. I'd include well-being, the opportunity for meaningful relationships and connections with others, safety from physical harm, safety from marginalization, stigma, discrimination. All of that needs to factor into adherence support, because it's all about everything that leads to self-care. So we can't think about just what's this tool I can give you to help you with adherence, because people don't exist in a vacuum like that. So really thinking about all of the systems in which they live and operate and feel good and thrive, those are all of the things that we really should be trying to either promote if people already have those things, or help get access to if they don't.
Mm-hmm. I think you all just hit all that on the nail of the head. I'm going to go back to something that Porchia said, but I think what I expand on that is that how important is the role of support systems such as peer educators, support groups, family, friends in supporting long-term ART adherence?
I think it's very important. So for me, like I said, in my family, we don't talk about things. Things don't get talked about. It's that culture of silence, and everybody knows, but nobody calls me. Nobody talks about HIV with me in my family. Nobody calls me to ask me if I'm okay or did you take your medicine? My mom did, but she's not here anymore. So, but even when I got to be an adult, she kind of stopped doing that. When I was a kid, yeah, but nobody does that. And so when you're connected to like a support group with folks who are going through the same thing that you're going through, you get that kind of stuff. I feel like we all feel the same way. So we since we know how each other feels, like we're giving each other that support. So, well, for me at least, I think it's super important. And then you just get to see an example. I didn't have aside from before I got connected to other folks who were living with HIV and going through the same thing I was going through, I only knew my mom, and that she was going through a lot of stuff mentally. And so that wasn't a good example for me, So then you get to see examples of, I thought I couldn't have kids. I thought I couldn't have, and you see other folks having married and happy and having kids who are negative and all of that. Like, you just get to see examples, So I just think it's really important. The social connectedness piece is really, really important.
Yeah, I totally agree. I mean, social connectedness is the key part. Where it comes from, I think, can be variable, right? Plenty of us don't have family that are going to be supportive, or friends that we had are no longer friends that we can count on. So I just want to emphasize that it's that connectedness part. It's the meaningful relationships part that can be so critical. And so I really appreciate what you were sharing about peers, because there's a whole level of connectedness from someone who is themselves living with HIV that just isn't there otherwise. So if you can be part of groups, it can be extremely helpful. If you can then mentor other people, that can be really powerful as well. But like we said with the support system, it's going to be different for everybody. What might be meaningful for one person might not be for someone else. So I think really making sure that we are aware that peer group's not going to be for everybody, but it's going to be the thing for other people. Getting family support, critical for some, not available at all for others. So there's lots of ways that you can connect socially. And I think being able to experience that, feeling of having real meaningful relationships is key for everybody's well-being, right?
I think that's so powerful. I want to thank my guests, Dr. Amico and Porchia, for joining me today, for their insights and expertise on this important conversation. As we approach a new year, I think sticking with our medications or our resolutions, is such a vital thing, but we can't do that alone. We have to have support, and we have to find the way that works best for each of us, whether that's pillboxes or support groups or peer educators. But the most important thing is having informed decisions and walking into our doctor's offices and knowing what it is that we need from our care teams and our support systems to help us stick with it. Because at the end of the day, just like Dr. Amico said, you're worth it, and you deserve to live an incredible life. HIV Connect is made possible through educational grants from Gilead Sciences and Merck & Company, which has no influence over the podcast series topics, content, or speaker selection. To learn more about today's topics and other subjects, visit AIDS-InfoNet at www.iaapac.org/support/AIDS-InfoNet, or click the link in the show notes. As IAPAC's Senior Advisor on Community Engagement, I want to hear from you. You can email me at kpugh@iapac.org. You can also find out more about today's guests in our show notes. Until next time, please be kind and take care of yourself and each other.